Hi, I'm Dr. Dan Lieberman. I'm a psychiatrist, a clinical professor of psychiatry, and the SVP of Mental Health at Hims & Hers. Zoloft is the brand name for the antidepressant Sertraline. It's used for the treatment of anxiety and depression. It is a member of a class of antidepressants called SSRIs, that stands for serotonin-specific reuptake inhibitors. And basically it means it modifies the activity of serotonin in order to bring about relief from anxiety and depression. Zoloft affects the brain chemical serotonin. It causes serotonin to become more active, and eventually this leads to changes in the way the brain functions, causing relief from symptoms of depression and anxiety. Some people get very lucky and they experience relief within a few days, but that's not common. It usually takes about 2 weeks to start feeling the effects and 4 weeks, sometimes even longer, to see everything that this medication is capable of doing. It's important to be patient, take your medication every day, and you may be surprised just how well it works. Zoloft is typically started at 50 milligrams for depression and 25 milligrams for anxiety. We like to start a little bit lower for anxiety because the initial dose can be a little bit activating, but sometimes higher doses are ultimately needed for anxiety compared to depression. The most common dose is 100 milligrams, but you can go as high as 200 milligrams if necessary. Zoloft, like other antidepressants, can have some early side effects that generally resolve after a few days, and then some more enduring ones, which can be a little bit more troublesome. Early on, Zoloft can cause a little bit of nausea. It's not too bad. It's how you might feel after getting off of a bumpy plane ride, although for some people, it can be more severe and lead to vomiting. Zoloft can also cause headache, sleep disturbances, and generally just feeling off, as if you might have a little bit of a cold. These tend to go away in just a few days. Now, longer term, Zoloft, like all SSRI antidepressants, can cause sexual side effects. Specifically, it can cause a decreased interest in sex and difficulty reaching climax. It happens to about 50% of people, and if you do experience it, it's important to speak with your provider. In many cases, things can be done to reduce them, sometimes even eliminate them. During the clinical trials that tested the safety and efficacy of Zoloft and other antidepressants, some people thought there was a signal that showed among young people aged 25 and younger, there may have been an increase in suicidality and suicidal thoughts. It didn't occur with people older than 25, and some people think that it may have been a result of simply a statistical anomaly. Whatever the reason, the FDA requires that antidepressants do contain this black box warning. Now, it's important to remember the biggest risk for suicidality is depression itself, and antidepressants effectively treat depression. So you shouldn't avoid treatment because of this warning. The most important thing is that if you do experience suicidality or any other side effect at all, be sure to talk to your provider. That's a difficult question. The problem is we don't have a lot of data. Scientists are reluctant to do clinical trials that could result in harm to a fetus. It doesn't seem like there's a large risk for congenital malformations, but it's possible it can increase the risk of birth complications. Now, it's very important to weigh these risks against the risk of untreated depression in pregnancy. Depression can change hormone levels, change behavior, and it can interfere with the ability of a mother to bind emotionally with her child right after birth, something that's incredibly important for the child's emotional development. When I'm treating women who are getting pregnant and are on an antidepressant, I tell them to stay on the antidepressant, and most of my colleagues do that as well. We're pretty convinced that the benefits of treatment outweigh the risks, but the most important thing is that if you do become pregnant while taking an antidepressant, make sure your OBGYN, your mental health provider, and anyone else involved in your care are aware of this and on the same page. Thanks so much for watching. If you have other questions about Zoloft or any other mental health topics, leave them in the comments and I'll do my best to answer them. And don't forget to subscribe so you don't miss a single episode about mental health and how to feel your best.